नमस्कार. इथे उपस्थित असलेले सर्व मान्यवर, संस्थेचे ट्रस्टी श्री वसंतराव कोकरे साहेब, डायरेक्टर जनरल श्री गायकवाड साहेब, दिवटे साहेब, त्यागी साहेब, इथे अजून सर्व मंचावरील मान्यवर, माझे मित्र किंवा माझे धाकटे बंधू ज्यांना मी म्हणू शकतो असे कॉलेजचे प्राचार्य डॉक्टर मस्के, माझे टीचर डॉक्टर गाडेकर सर, सर्व हेड्स ऑफ द डिपार्टमेंट्स, टीचिंग नॉन टीचिंग स्टाफ, स्टुडंट्स, फ्रेंड्स, लेडीज अँड जेंटलमॅन. मी सगळे आतापर्यंतचे सगळे मराठीत बोलले. मी मराठीत बोलू शकतो, पण काही मुद्दे मी लिहून आणलेले होते ते इंग्रजीत आहेत, तर त्यामुळे मी दोन्ही मराठी आणि इंग्रजीमध्ये बोलायचा आणि आपल्याशी संवाद साधायचा प्रयत्न करतो. सो आय थिंक इट इज indeed an honor for me to be coming here as a chief guest for this very important function of the 22nd Foundation Day of the Vithalrao Vikhe Foundation Medical College here in Ahilyanagar. Thanks to Dr. Maske who invited me. In fact, he was behind me last year also. He called me, and before that also he said, "Sir, come over once." And somehow I think it was not matching, but this time, in fact, the date also suited, and thanks, I'm here. Thanks for the kind invitation. As a matter of fact, when you're inviting me here for this very important day, it is my honor, and I am really privileged to be here on this important day. The outset, let me extend my sincere greetings to you on the Foundation Day. Foundation Day 22nd, 21 वर्ष तुमच्या या संस्थेला, या कॉलेजला पूर्ण झालेली आहे, आणि 20 वर्षाचा हा एक जो महत्त्वाचा टप्पा तुम्ही मागच्या वर्षी पूर्ण केला. सो थिंक दिस इज अ लँडमार्क अचीवमेंट, and it is not just in terms of number of years, but I think the achievements, the holistic or all-round development that the college has seen, it is truly commendable. And it is a time on this day, that is a Foundation Day, to reflect on our past achievements and to chart a course for the future. Foundation Day, otherwise many of us will say, okay, what is there? Foundation Day, एक दिवस येतो, एक दिवस जातो, आपला वाढदिवस असतो, आपण काहीतरी थोडं सेलिब्रेट करतो आणि विसरून जातो. पण नाही, फाउंडेशन डेच्या दिवशी एक थोडंसं आपण चिंतन मनन केलं पाहिजे. आपण कुठे होतो, कुठून आलो, आता सध्या काय परिस्थिती आहे आणि पुढे काय करायचं आहे. जर का याचं आपण चिंतन मनन केलं तर नक्कीच ह्या सगळ्या गोष्टीचं आपल्यालाही त्याच्यामधून काही शिकता येईल आणि आपणही काही त्याच्यामध्ये कॉन्ट्रीब्यूट करू शकू. सो प्रथमतः सर्वांचं या शुभदिनी अभिनंदन, अभिष्ट चिंतन. I would like to congratulate all the awardees, award winners, academic awards, awards in extra and co-curricular activities, and also the staff and the students, that is faculty and the non-teaching staff, who have served this organization, who have served this institution for more than 20 years. Well, the awards were given, and I could hear some whisper that in all academic awards, they're the dominance or predominance of girl students. But this must be commended. I think it is something that is I think women empowerment, we can say. That I think the girls are coming forward, the girls are leading the way. So somewhere it is very important for the boys to catch up. Of course, boys have won some awards in extracurricular and co-curricular activities, but they must also, enter into a healthy competition. And next time, at least few academic awards, I hope and wish to see that some boys will win. So I wish them the best, but my congratulations to all girls, all the students, achievers. It signifies the women power and women empowerment happening at this place. Uh, I can't start without my gratitudes to the founding fathers of this great organization, starting from Padma Shri, Honorable Sri Vithalrao Vikhe Patil Saheb, who laid the foundation of cooperative in this drought prone area. Then now, of course, irrigation facilities are there in most part of the Nagar district. But then it was a drought prone area, and starting cooperatives, starting sugar mills, empowering rural people, giving them livelihood through cooperative movement in those difficult times. It was truly commendable job, and his work is recognized, and it is much appreciated. Similarly, I had the fortune of personally knowing the late Honorable Padma Bhushan Balasaheb Vikhe Patil Saheb. He was a truly a visionary, towering personality. Think bringing education in the rural area, rural most area. I know Loni because I served there for a short period, about a year or so, early on in 1990s. So think then also, if somebody is going to Loni, where is this Loni? What is this place about? Nobody knew about it. But establishing a medical college in this remote area, and then it's not just establishing it, ensuring that it meets all the benchmarks, all the quality parameters. It had best of the infrastructure, best of the facilities, best of the hospital structure, very good, very renowned doctors on their panel. I know then Dr. Purandare, Dr. Snehalata Deshmukh, and there were so very many other people who were associated with the medical college early on. So hats off to his wisdom, hats off to his courage, that he sowed the seed of education, and education as a means to empower the rural people, education as a way to change their lives. And I think we can see in this area, Nagar district, it's not just about Ahilya Nagar, but Loni and so very many other parts, primary education, school education. I remember, actually I studied in a Sainik school. And I don't know, Saheb's one son, Ashok Vikhe Patil Saheb, he also studied in Sainik school. And then therefore they started this Praura Public School. And the first principal of that Praura Public School was Colonel Puri, who was the principal of Sainik School Satara. So I think all the good things, good practices, whichever the Balasaheb Vikhe Patil had seen, okay, public school in rural areas, it's something which is unheard of. So he started the public school. He wanted medical college, engineering college, pharmacy college, and I don't know, there are so very many institutions in this area. Thanks to his vision, thanks to his legacy, and thanks to his untiring efforts. And in spite of all this, he was a very simple person. He will always be in his trademark white shirt and a pajama and a cap. In Delhi circles, he was an MP for 9 terms. And once we happened to be in Delhi, of course, those days in 1990s, I remember, and Delhi cold, so he was wearing this muffler लावलेलं होतं डोक्याला आणि पैजामा बंडी वगैरे असे शर्ट होतं. तर आम्ही तिथे गेलो. आता त्यांना मी 1-2 वेळा भेटलेलो होतो. असं काही खूप असे हे नव्हतं की एकदम माहितीतले वगैरे. तर आम्ही म्हटलं की आता आपण तिथेच काम करतोय, तर आलोय तिथे दिल्लीत, तर साहेबांना एकदा भेटावं. तर काहीतरी मला वाटतं शनिवार का रविवारचा दिवस होता, संध्या 4-5 वाजले होते, दिल्लीत थंडी असते. आणि मग आम्ही गेलो साहेबांच्या घरी. आणि साहेब म्हटलं साहेबांना भेटायचंय. तर साहेबांनीच दार उघडलं आणि ते टोपी वगैरे बघलं, मफलर बांधून वगैरे होते. 1 मिनिट आम्ही ओळखू नाही शकलो त्यांना. म्हटलं नाही विखे पाटील साहेबांना भेटायचं आहे. तर ते म्हणे बोला ना, मीच आहे विखे पाटील साहेब. So the point is that he was rooted in the soil. ही वॉज ऑलवेज हॅड रूट्स. आय मीन, आणि त्यांची राहणी बोलणी इतकी साधी सरळ होती. देन ऑफकोर्स त्या थंडीमध्ये त्यांनी आम्हाला चहा काय विचारपूस केली, कुठे आहे काय आहे सगळं व्यवस्थित हे केलं. आणि आम्ही म्हटलं नाही, जस्ट आम्ही आलो होतो इथे, आपल्या इकडे काम करतो म्हणून आपल्याला भेटायला आलो, काम काही नाही आहे वगैरे. बट ही वॉज व्हेरी कॉर्डियल, ही वॉज व्हेरी, आय मीन फॉर समवन हू इज व्हेरी न्यू ज्युनियर पर्सन, पण ही वॉज व्हेरी, त्यांनी इतकी आपुलतेने विचारपूस केली. आणि मला वाटतं हे सगळ्या एम्प्लॉईच्या बाबतीत असंच असावं. आणि त्यामुळे हे जे एक प्रवरा किंवा एक जे हे सगळं उभं आहे, तर हे त्यांच्या त्या सिम्प्लिसिटीमुळे, त्यांच्या त्या कनेक्ट विथ पीपलमुळे, आणि त्यामुळेच त्यांचं नाव एवढं मोठं आहे. त्यांना पद्मविभूषणनी पण सन्मानित करण्यात आलेलं आहे. आता सांगितलेलंच आहे, आता याची धुरा राधाकृष्ण विखे पाटील साहेब आणि डे टू डे सुजय विखे पाटील, दोघेही अतिशय तडफदार, डायनॅमिक, आणि सुजय विखे पाटील पर्टिक्युलरली young, dynamic. He has achieved so many things in a short time. He himself is a neurosurgeon. He himself understands medicines. So he is having best of both the things in academics, in medicine, as well as in politics. So I think with such a strong leadership, I think the only way in this organization can go is up. And therefore, I have no hesitation in seeing that it has come a long way, but still it has a very bright future. So friends, I think when we are here as reflecting on whatever our journey, कुठून आलो आपण, काय झालो, काय करायचं आहे, तर याच्यामध्ये आता असं ॲडवाईस देणं, बोलणं खूप धाडसाचं ठरेल. आजकाल आपल्याकडे ॲडवाईस किंवा every day we are bombarded with messages on social media. Do this, don't do that. I mean, कसं तुमचं, I mean, what should you eat, what should you do, what you should not do, and so on and so forth. So it is very courageous to maybe say something, but considering the occasion, considering the majority of the people are from the medical field, so I just thought that I'll share some of my experiences in the sense that few thoughts which may resonate well with our profession as well as occasion. And I think it is related to a book. सुनील मला वाटतं बरेच पुस्तकं वाचतो, त्याच्यानंतर त्याचं बरेच ठिकाणी काही ना काही नवीन नवीन करण्याचा ध्यास असतो. तर तुमच्यापैकी काही लोकांनी तरी हे पुस्तक किंवा हे एक इंडियन ओरिजिन ऑथर आहे, सर्जन आहे, अमेरिकेत हार्वर्डला असतात, तर डॉक्टर अतुल गावंडे म्हणून नाव ऐकलं असेल किंवा कोणी काही पुस्तकं वाचले पण असतील त्यांचे. सो त्यांनी एक बऱ्याच वर्षापूर्वी एक पुस्तक लिहिलेलं आहे. त्या पुस्तकाचं नाव आहे बेटर. वाचलंय कोणी? नाही, वाचलं नसेल तर जरूर वाचा. म्हणजे इथे जे कोणी विद्यार्थी असतील तर त्यांना माझा एक सल्ला असा असेल आहे की तुम्हाला अभ्यासाचे पुस्तकं, जे तुमचे परीक्षेसाठी लागणारे महत्त्वाचे पुस्तकं, नोट्स वगैरे आहे, ते वाचायला लागणं खूप जरुरी आहेच. त्याच्याशिवाय तुम्ही पास नाही होऊ शकणार. पण त्याच्यासोबत थोडंसं, म्हणजे आता माहिती आहे आपण जवळजवळ प्रत्येकाचं आजकाल हे स्मार्ट डिव्हाइसेस झाले, तुमचा स्क्रीन टाईम किती झाला, काय झाला ते सगळं दाखवतं. तर थोडासा एक रोजचा 20 मिनिटं स्क्रीन टाईम कमी करायचा प्रयत्न करा. मी पण आमचा वीकली रिपोर्ट, डेली रिपोर्ट येत असतो की साधारणतः 2.5 तास स्क्रीन टाईम झाला आहे, कधी 4 तास झालेला आहे, काय आहे काय नाही ते. सो ते 3-4 तास स्क्रीन टाईम करण्यापेक्षा त्याच्यातला थोडा एक 20 मिनिटं अर्धा तास कमी केला आणि जनरल काहीतरी वाचलं तर इट कॅन डेफिनेटली widen our horizons. So coming to the point, this book Better by Atul Gawande, a renowned Harvard surgeon, and in this book, in the last 5, 7, 10 pages of the book, he gives 5 suggestions to the medical fraternity, and that are very apt for the day, and where one may be able to make a worthy difference and be a positive deviant. सो आय मीन, जर का आपण हे त्यांनी जे 5 सजेशन्स किंवा 5 सल्ले दिलेले आहेत त्याच्यावरती थोडंसं जरा आपण एक इंट्रोस्पेक्ट केलं तर त्याच्यावरती, सो ही सेज अँड आय कोट, त्याचा पहिला जो मुद्दा, फर्स्ट सजेशन दॅट ही गिव्स इज डोंट कंप्लेन. डोंट कंप्लेन. आता वी आर इन मेडिकल प्रोफेशन. medical profession is a service. It is a service sector. We have to be at the, we have to serve the patients. Patients are not somebody, patients are someone who are in pain, who are in misery, who need some help, who need some assistance, who need some care. So I think that is something which the patient needs, patients wants. And if we are able to, if we are not able to provide it, then there is a problem with that. And many a times we complain ki, oh, medical profession, I mean, we have to do these emergency calls, we have to come at the middle of the night, or maybe, I mean, on Sundays, on holidays, we can't have holiday, we can't go out for a party. But if you have chosen this as your profession, and if you have chosen this as your calling, then I think there is no reason to complain. You can have observations, you can give suggestions to improve on what the systems are. But if you are complaining, you are, I think, demeaning, you're not able to give your best, because you're not happy about the things. And if you're not happy about it, then you will not be able to give your best. So number one suggestion that Dr. Atul Gawande in his book says and quotes is, medical profession is a different profession. It is not a profession, but it is a calling. And patients don't come here to trouble you, or to spoil your holiday, or to spoil your party or something, because they genuinely need some help, need some assistance, need some care, and therefore they come. And therefore I think we should not be in a, always in a mood, agitating mood, or I mean, always be unhappy about ourselves and about the patient, and then we will not be able to give our best to the patient. So that's number one. Number two, these days we say that there is a doctor-patient relationships are, I think, a point of discussion. We hear and read in the newspapers about many issues like manhandling of the doctors, and then I think all sorts of brawls happening in patient, I mean, hospitals, some breakages, so many things, unpleasant experiences, etc., etc. Now, why this happens? Why this happens is primarily, I think, there is a lack of trust between the doctor and the patient. And why this lack of trust is there? Because the doctor and patients are not connected. They I mean, they just look at each other as, I am a service provider and he is a consumer. And that relationship really, I mean, there is hardly any bonding, or there is hardly any connect. So I mean, the second question, to develop this connect, to develop some kind of a bond, to develop some kind of relationship, what Dr. Gawande says is, ask an unscripted question. Now you'll say, what is this Greek and Latin unscripted question? हे काय तर काय आले, बाहेरून आले, पुण्याहून आले, काय तर बोलतात, काय आम्हाला काय समजलं नाही, समजत नाही. So I mean, forget about that unscripted. What unscripted question means is that beyond what is required, try and work on that. I mean, our profession demands, if there is a patient of pain in abdomen, काय झालं, कुठे दुखतं, कधीपासून दुखतं, किती वेळा दुखतं, त्याच्याबरोबर काही ताप आहे का, त्याच्याबरोबर अजून काही उलट्या जुलाब होत. So these are the things that we are expected to ask. सो दीज आर दी थिंग्स दॅट इज स्क्रिप्टेड. हे जे आहे हे मॅन्डेटरी आहे, हे विचारायलाच लागणार, बिकॉज त्याच्याशिवाय तुम्हाला पेशंटबद्दलची माहिती मिळणार नाही. पण त्याच्याशिवाय थोडंसं पेशंटशी कनेक्ट होण्याच्या दृष्टिकोनातून, पेशंट की बाबा तू कुठून आला, काय आला, घरी कोण आहे, आई वडील काय करतात, कोण कुठे आहे. सो आय थिंक देर इज समथिंग विच इज बियॉन्ड what is prescribed, what is beyond, which is beyond what is scripted. So that is a unscripted. So if you go little beyond, spend maybe 2 3 5 minutes more asking something to the patient, and you never know how you will develop that connection with the patient. आणि I mean, आता इथे जे सर पहिले आपल्या इकडे चान्सलर साहेब होते, म्हणजे लोणीला, प्रवराला, केळकर साहेब, हां, तर आता केळकर साहेब एवढे मोठे पद्मविभूषण स्टेटमध्ये सेक्रेटरी होते. आमच्याकडे केव्हा तरी एका कार्यक्रमाला आले होते ते. आता ते मेडिकल कॉलेजला आज असं डीन आहे, मी डीन होतो तेव्हा मेडिकल कॉलेजला. सो वी हॅड टू रिसीव्ह द गेस्ट आणि ते कार्यक्रमाला जाणार होते त्यांच्या दुसऱ्या कार्यक्रमाला. तर ते वेळेवरती आले म्हणण्यापेक्षा थोडंसं 10 मिनिटं वेळेच्या आधी आले. आणि मग आता मी त्यांना रिसीव्ह केलं. आता रिसीव्ह केल्यावरती ठीक आहे सर, चहा-पाणी काय वगैरे असं थोडं विचारलं आणि मग जनरल असं एक कन्व्हर्सेशन की काय करता तुम्ही? कुठून आले? काय आले? सो आय थिंक त्या केळकर साहेबांचं आजोळ हे खामगाव, बुलढाणा जिल्ह्यातले जे माझं गाव आहे, माझं आजोळ आहे ते. त्याच्यानंतर असंच त्याच्यानंतर मग असंच हे पुस्तक कुठलं वाचता? काय करता? मेडिकलमध्ये नवीन काय झालेलं आहे? आणि असे जे जनरल प्रश्न आहे, नाहीतर ओके ठीक आहे, आलोय मी, बसतो 5 मिनिटं, जातो, माझं काम झालं की. सो आणि आता कुठेही भेटले म्हणजे आता धिस इन्सिडेंट्स आय एम टॉकिंग ऑफ 10-15 इयर्स बॅक. बट आय हॅव डेव्हलप आय मीन आय हॅव हिज नंबर, ही कॉल्स मी, ही सेंड्स मेसेजेस टू मी. आणि आता एवढ्या मोठ्या माणसाशी तसा माझा संबंध यायचा तसा काही आय मीन देर इज नो रिझन फॉर दॅट. बट जस्ट बिकॉज वी डेव्हलप दॅट कॉमन कनेक्ट. So I think this connect is very important. I mean, many a times you say that what differentiate a good doctor from a average doctor or a poor doctor? Skills, knowledge, majority of them everyone will have more or less same. It may be 8 on 10 or 9 on 10, somewhere 7 on 10. पण बहुतेक सगळ्यांचं असं काही खूप एखादा खूप एक्स्ट्रॉर्डनरी हुशार आहे आणि एखादा एकदमच ढमठ्ठ आहे असं काही होत नाही. बहुतेक सगळ्यांचं दे आर इन अ रेंज बिटवीन 6 ऑन 10 टू 9 ऑन 10 और 10 ऑन 10 खूपच चांगले असतील तर. पण व्हॉट मेक्स अ डिफरन्स इज कोण हू पुट्स पेशंट ॲट इज, who puts patient at comfort, who connects the patient well, आणि those people become successful. पुण्याला आता साहेब सांगत होते, सरदेसाई साहेबांबद्दलचं एक्झाम्पल दिलं त्यांनी, किंवा पुण्यामध्ये आता वन ऑफ द सिनियर ऑर्थोपेडिक सर्जन के एच संचे, ते बऱ्याच जणांना माहिती असतील आहे. सो आय थिंक आय मीन व्हाय दे बिकेम सो बिग. और ठीक आहे त्यावेळेला कॉम्पिटिशन थोडी कमी होती, कमी लोक होते, त्यामुळे ते त्यांना थोडंसं अजून फास्ट ट्रॅक झालं. पण इट इज बिकॉज ऑफ देअर दीज ॲट्रिब्यूट कनेक्टिंग विथ द पेशंट. आणि सिमिलरली वी नीड टू कनेक्ट विथ द स्टुडंट्स. आता इथे स्टाफ मेंबर्स आहेत म्हणून मी बोलतो की आय मीन आपण आता सध्या स्टुडंटशी पण आपला कनेक्ट खूप कमी राहिलेला आहे. आणि त्यामुळेच ते स्टुडंटही येतात का नाही, शिकतात की नाही, आणि शेवटी काय ते स्टुडंट म्हणतात की आम्हाला 50% मार्क मिळवायचे आहे, पुढे नीटवरतीच आमचं सगळं ठरणार आहे. आणि स्टाफही म्हणतो की जाऊ दे बा, त्याला नाही काही इंटरेस्ट तर मी कशाला जास्ती त्याच्यावरती त्रास करून घेऊ. सो एक असा तो एक डिस्कनेक्ट झालेला आहे. आणि त्या डिस्कनेक्टमुळे मग आय थिंक समवेअर जे रिलेशनशिप आहेत, आता सुनील, I mean, I don't know, long time back, he was a student there. But I mean, not because I am in a position, but we know for very many years, not that I was excellent or a great teacher, I may be little above average teacher. But I mean, why people remember some teacher? Bhushan is also here. Bhushan was our first batch student in Bharati Vidhyapith. So I think some of these students where we connect well, or the students connect well after so many years. आणि टीचरला सगळ्यात मोठं जर का काय त्याचं ट्रेजर किंवा काय असेल, टीचर्स पॉसिबली डोंट गेट रिच, दे विल नॉट बी एबल टू अर्न मनी लाईक समवेअर इन युअर क्लिनिकल प्रॅक्टिस और प्रायव्हेट प्रॅक्टिस, बट they will be able to gain that respect, they will be able to earn that respect which is priceless. And so therefore I think that connect with the patients, connect with the student is very important. And how we are able to connect with the patients, connect with the students, so that should be our endeavor. And in this, the suggestion which he gives is try and do something little more than what is required. Try and do, when he says ask an unscripted question, I mean scripted or what is required everyone will do, because that the profession or that you is required. But try and do something which is more, and if you do that little more, then I'm sure that I think that difference between good and very good, or that difference between good and better and best, so that will be that subtle difference. If you are able to connect, if you are able to develop, at least I can say, I mean, because of that little extra effort, because of that little maybe, I mean, extra whatever, I can say that I could reach where I am. Not that I am something to be celebrated or something, but I got opportunities, and I consider myself lucky. But it is because of that additional extra connect extra, which is beyond the call of duty or beyond, whatever is required. So the second suggestion, number one, is don't complain. Number two is a unscripted question. Number three, आता everyone talks about research. आय थिंक तुमच्याकडे असेल प्रेशर्स असेल फॅकल्टीवरती की सगळ्यांनी पब्लिश केलं पाहिजे, प्रोजेक्ट्स लिहिले पाहिजे, काय केलं पाहिजे. सो व्हॉट डॉक्टर अतुल गावंडे सेज, and I quote, is that he says that count something. आता आपण मे बी आता इथे समजा इथे या तुमच्या हॉस्पिटलमध्ये आहे किंवा पुण्याला भारती विद्यापीठमध्ये किंवा आधी मी केलेला होतो किंवा अजून दुसरीकडे कुठे आहे, तर ठीक आहे, आपल्याकडे पेशंट्स थोडेसे कमी असतात, जास्ती असतात, कुठल्या डिपार्टमेंटमध्ये व्हेरिएशन्स असतील. पण इफ यू स्टार्ट काउंटिंग समथिंग दॅट स्मॉल over a period of time becomes meaningful. So I think it says that we come across different challenging situations. Each patient has a unique presentation, but if we start counting the commonalities, the differences, it starts connecting the dots. We can come up with innovative solutions, and that small something over a period of time can become something where not only do we learn, but we can make sense out of it and help others. So I think many a times we'll say, हाँ ये क्या है, 4 पेशेंट एक हफ्ते में आते हैं या 2 पेशेंट एक महीने में आते हैं, and इसका क्या है, क्या करेंगे आप. But that 2, that 4, that 1, that whatever X over a period of time makes sense. So count something, keep a record of it, keep a diary of it. Nowadays with all these electronic gadgets, it is not very difficult to keep a tab of all things. In fact, we have fancy software, so many things, etc. So I think if you start counting something over a period of time, it starts to make sense, and it's not only that we learn, but we are able to also contribute our whatever little into the scientific arena. His fourth suggestion is write something. And when he says write something, that means that it need not be scientific writing. It can be something, it can be just a small blog, it can be a small reflection of your day-to-day activities. It can be just anything which you feel that okay, it is worth noting down. पूर्वी म्हणायचे एक डायरी लिहिली पाहिजे. डायरी लिहायचं काय कारण असायचं की ओके, दिवसभरातल्या काय महत्वाच्या गोष्टी आहेत, काय आहे, तर त्याचा आपण एक थोडंसं रिकॅप्चर करायचे. पूर्वी आता आय रिमेंबर माय फादर यूज टू राईट, नॉट खर्च हिशोब लिहायचे संध्याकाळी आपल्या आल्यावरती, की ठीक आहे त्यावेळेला भाजीचा खर्च ₹2.75 असणार, पण तरी ते आपले लिहायचे की आता आपण म्हणतो की 10 रुपये, 100 रुपये, 500 रुपये आपण कुठे येतात आणि कुठे जातात समजत नाही. पण असं एक पूर्वीचे ते लोक लिहायचे. तर राईट समथिंग, अँड रायटिंग हेल्प्स अस टू क्रिस्टलाइज आवर थॉट्स, reflecting our experiences, writing about that not only helps deep learning, but we can share our perspective to the world. So I think that is very important, and that's how if we sow a small seed, then we can convert it into scientific writing, we can convert it into making it publication. So if we start writing, and by the way, writing is not easy. If you have to write 1 page, you have to read 10 pages. So overall I think it is a cycle, and then you continue to evolve, you continue to grow, you continue to mature, and I think at the end of the day, that is what is required to achieve success or to gain whatever your objectives are. And his final suggestion is adapt to change. आता we have adapted to technology, but when it comes to something की आपण म्हटलं आता मेडिकलमध्ये CBME करिक्युलम आलेला आहे, ते काय CBME आहे, काय आहे, कशासाठी आहे. सो वी हॅव सेल्फ डाऊट, वी आर स्टार्टिंग दॅट ओके, is it required, it unnecessary increases the work, and so on and so forth. So we start again complaining, we start rather than accepting the change, we start giving excuses, we start finding faults with it. I think wherever necessary, not for the sake of accepting it, but wherever necessary, it is important to adapt change, and change is the only constant. So we may not be innovators, but we certainly can be early adapters and change our perspective and practices. that are contemporary and relevant. So, I mean, if you want to be relevant, I mean, I am a surgeon. Of course, now I hardly operate, or I don't operate for that matter. Why I don't operate? Because I have not adapted with the changing needs. I mean, I was dean early on, and then again, again don't want to give excuses, but I didn't adapt. I didn't learn to do laparoscopic surgery or minimal access surgery, and minimal access surgery is the order of the day. So I become obsolete. So unless, of course, you change, you adapt to the change, you adapt to the contemporary practices, then only you will become relevant. So it is very important to adapt to change or accept change, and then I think work on to give better to whoever our stakeholders are, that is the patients or the students. So I think these are the 5 suggestions that he gave, which I thought are very relevant, and I think I will again summarize them. Number one, he says is don't complain. Number two, he says is ask an unscripted question. Number three, count something. Number four, write something. And number five, adapt to change. In fact, you can even Google them. Nowadays, it is very easy. Whatever it is. So if you say Atul Gawande 5 suggestions, or 5 whatever, Atul Gawande's 5 prescriptions or something, you will get 1 page or 2 page note on that. But I think it would be really interesting. I mean, to look at. He has written some very nice books. Complications, Better. First was Complication 25 years back, Better. Then last, of course, came 5 years back, is Being Mortal, and some of the other things. So that's the point. But apart from that, I think I cannot end without emphasizing the importance of technology. So I think apart from the 5 suggestions, the last thought which I want to leave you with is that technological advances, technological changes that are occurring are phenomenal. And if we are not able to adapt or know what are the changes happening, then we will be remaining irrelevant. I think there is this big onslaught of artificial intelligence, data analytics, robotics. In health sciences, there is genomics, precision medicine, personalized medicine, etc. In fact, I think about 1 month back, there was a newspaper article that the first gene therapy, that CRISPR gene therapy, gene modulation therapy, and one 2-month-old baby was saved by the modulation of the gene. So I think in next 10 years or so, I think it is going to be all precision medicine. It's going to be all personalized medicine. So if you have a gene for diabetes, they will do some small genetic engineering, and I think then your diabetes and other things will automatically be taken care of. If you have gene for cancer, or if you have whatever that gene, already some of these things are in practice. So that is something which is coming in medicine, and the AI, other things which are coming, which are going to take the repetitive jobs, the jobs which possibly doesn't require that human intelligence or empathy or something like that. But so we need to adapt to technology. Second areas which everyone must be wearing a smart watch. So now smartwatch, wearables are coming in a big way. And wearables means, I think it's not just about smartwatch, but I think we have these implantable devices. And again, I mean, some 6 months back, there was this Elon Musk company, Neuralink. And Neuralink, they implanted the chip in a brain. And when they implanted a chip in a brain, that patient with whatever Parkinson's or whatever that disease, he was treated. And so I think all these therapies are going to change the healthcare scenario like never before. So I think what we are here today, we are uh, going to teach and train tomorrow's professionals, the doctors who will be in their practice for next 30 or 40 years. They will be graduating maybe in next 2 or 3 or 5 years, but they will be in the profession for next 50 years. and in next 50 years, I think there is going to be a sea change. We can't predict what will happen in next 5 years, so lest we don't know what's going to happen in 50 years. So I think it is very important to really know what is current technology, what are the things which are evolving. And for this, it's not just about the education in the college, but lifelong learning. So I mean, something which is again very important, we need to be lifelong learners. We can't say that, okay, I mean, I have got my MD or I have got my MS and I think that is about it. So that is not going to be sufficient. We are going to be updating, upgrading our knowledge, upgrading our skills. As I said, if I didn't upgrade my skills with laparoscopic surgery, I am going to be irrelevant. So tomorrow, if we don't upgrade with whatever robotics, I mean, still India is a big country. I mean, to percolate it to a lower level, it will still take time, 10 years, 20 years, 25 years. But we cannot, I mean, if the patient wants best, we cannot tell him that no, we will not be able to give you because you are in rural area or you are in semi-urban area. The patient will have all the choices. Patient will be able to get whatever he or she wants. So the point is, technology is here. Technology is affecting our lives like never before. These advances in the spheres of science, technology, medicine have made our lives better, but they have at the same time posed newer challenges. So the routine jobs are being outsourced. Advances in medicine have led to increased longevity and diagnosis of unknown diseases. But then I think we have to be ready to face these challenges, and not just face these challenges, but surmount these challenges and find innovative solutions to all these things. So, friends, we are here in the era of smart devices. So everything is smart, smartphones, smart homes, smart cities, smart roads, everything. We are in the so we have also to be working smart. It is not enough today to say work hard. Work hard is okay, fine, everyone works hard. But today it is time to say you should work smart, because day only has 24 hours. Whether we like it or not, we can't extend time, we can't compress it. So if we have to make most of it, we have to be adapting to it. We have to be working in a smart way. We have to manage ourselves well. We have to manage our time well. We have to prioritize what is required. So we have to be like smart devices. We have to be smart. And then, as medical professions, I mean, I keep saying this because many times what I see in the hospitals wards is something that needs attention, and particularly for senior doctors here, I think we should be role models. So I think carrying ourselves with dignity and pride. I mean, a doctor, resident doctors, many times I see in wards, I think they are, I mean, whatever way they dress, whatever they carry themselves. So I think that is far from desired. As I said, medicine is something which we deal with other patients, live human beings. And when we will be able to gain the confidence of the patient is, I think, if we feel, if I am looking as a patient, I am looking sick, unshaven face, I mean, wearing some lousy jeans, wearing some, I mean, again, we are not encroaching on individual liberty and freedom. But at the same time, the profession calls for some pride, some dignity, and the communication. So I think all these small things matter a lot. So these little things can make a big difference. And finally, I think when we are in medical profession, in spite of all artificial intelligence, in spite of all technological these things, we cannot forget the virtue of empathy, that feeling for others. So I think that is again the core. I mean, apart from all these things, so that empathy, if you are sensitive to the your needs, others needs, then only you will be able to make difference. So believe in yourself, be humble, respect others, respect your colleagues, respect your seniors, subordinates, and be truthful not only to others but to yourself. And have focus. Spend your time and energy and resources in a focused manner to achieve goals. So I think these are some of the things which our teachers needs to imbibe to our students. It is easier said than done, but then efforts towards this will certainly start yielding some changes. So friends, I think on this day it is important, as I said, to reflect on and see that how we are able to fulfill our responsibilities, our goal, and how we are able to make difference in the lives of our patients, make difference in the lives of the students, and that way contribute towards societal good. So I think on that note, I end with a quote of father of nation Mahatma Gandhi, and I quote, he says, live live as if you were to die tomorrow. So live a very fulfilling life, live as if you were to die tomorrow, and learn as if you were to live forever. So never cease to learn and live in the moment, live in the present. So never cease to learn and live your life well in present. With this, I once again thank Dr. Maske, all the trustees, directors for inviting me here and giving me opportunity to share my thoughts with you. And I think I certainly acknowledge, appreciate the good work you all are doing, and wishing you the very best for all your future endeavors. Thank you very much. All the best. Jai Hind, Jai Maharashtra.